Hello, ladies and gentlemen. It's Paul Ramsey. I am back, and I'm back with Frederick Ma, who is facilitating a 1-hour seminar, another one. We talked earlier. He's doing 2 1-hour seminars at the 2019 NGH convention on the Sunday of convention at 2 p.m. Frederick's going to be talking about Speechless for 6 months, a fascinating case study that he had. How are you, Frederick?
I am doing great, Paul. How are you today?
I'm great, and this is what I was just telling you earlier before we started recording this officially. I'm going to want to talk to you about the whole thing and make you give away your whole 1-hour presentation. So I'm going to restrain myself from that. You had a client who couldn't speak for 6 months.
Yes. 16-year-old, otherwise healthy African-American young woman. She was unable to speak for 6 months. Interestingly, not because of like a trauma or something, but following a bout of the flu. And that was what like set the whole thing off. And even though there was nothing physically still going on after 6 months, she was like all better from it. Like psychologically, things were locked down. This was an example of conversion disorder. And hypnosis is great for treating conversion disorder. So I'm a mental health counselor. So I use words like treat and diagnose.
You can. I can't. Yeah. So because I don't work in that world, I don't even know the proper definition of conversion disorder. Can you tell me what that is?
It's an emotional problem, has a physical body effect. Probably the most famous example of this in hypnosis is Maria Therese von Paradis back in Vienna back in the day with Anton Mesmer, who had what they call hysterical blindness. We would call it functional neurological disorder blindness or conversion disorder blindness now. Mesmer managed to cure it, and she got better, and that's why he rocketed to fame. And I actually think that's the entire reason we're even aware of Anton Mesmer as a historical figure. So this is it. Like, we've been treating this stuff for a long, long time. I have many other clients with these sort of issues that I've treated. Everything from like psychogenic seizures, which are seizures without an underlying cause, to pain that is psychogenic. It doesn't have any physical cause to it. Different kinds of tremors, several different issues with this. So I touch on a number of different clients. I really focus on this one client though. You get to hear the audio of her getting better in one session.
No way.
Yes, it's delightful. I walk through the process. I'll show you exactly what I did. You'll get to hear the audio of her where she's begins to speak. Like, you can hear how difficult it is, and then she begins to speak. The whole thing, I'll talk about the neurology of it, how it functions.
Is this part of a broader, the term that I've heard over the year, is this an idiopathic condition? Have you ever heard of that?
I guess you could use that term for it. That's not the way it's usually framed.
No.
Conversion disorder is, it tends to be really frustrating for doctors because there's not an underlying basis for it. So they're going and they're doing medical things, and they're operating from a point of view of biomechanics and biochemistry.
Right.
And they're not finding anything wrong. And honestly, people tend to think folks are faking. But it's not faking. Things are locked down at an unconscious, at a limbic level.
Yeah.
And it really is conversion phenomena. Going back to Janet, the French neurologist back in the day, he actually was the first one to identify a linkage between conversion phenomena and hypnotic phenomena, that they operate the same way. Like when you do an arm catalepsy with someone, that's a great thing to do in a show. If it happens spontaneously and like the person can't get it to stop, that's conversion disorder.
Right. I had a client, I had a client come to me maybe like 10 years ago. And it was I don't seek out clients really. I started in stage hypnotism, and what I would do over the years is when people would see my shows, if they asked me to do client work, then I was like, yeah, okay. So that's what happened. I had this woman who came to one of my shows, and she had a daughter who was struggling with something. She said, "Can my daughter come see you?" And I was like, yeah. So her daughter comes in, and she tells me that she has she's been diagnosed with I can't remember the full term, but it was idiopathic, blah, 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 blah. And it was this idea that her hair was falling out and she had like several different kind of presentations, and she had been checked out by something like 15 doctors at 6 different hospitals. And they had finally just gotten to this point where they're like, look, there's no pathology here. We've run every test we can run. You don't have something that's causing this within you, you know? And so they gave her, this disorder, this idiopathic disorder kind of diagnosis. And so then when she told me that, and I was like, because I'm not a licensed, counselor or therapist, I was like, well, you need to go get a doctor that tells me it's okay for you to work on this using hypnosis. And she was like, yep. And because they were all like, we're done with you, basically, So literally the same day, she was able to get a doctor who sent me a digital copy of a letter saying, yeah, you can work on hypnosis, whether that's fine. But I was fascinated by that. And unfortunately, I'm getting to why, this all comes back to you eventually. I had never worked on anything like that before, and I didn't really know how to approach it. So I was sort of just doing my best, and I was not able to get her to get a real positive result. And I always really felt sad about that, because it was clear that she felt she had run out of options. And so I wish that I had had a chance to hang out with someone like you at convention and learn from a session like this, where maybe then I could have gone back and applied something to her and helped her get a result.
I think what you're talking about with the idiopathic part is a medical description of that. And over here in the counseling and psychology world, the conversion or the functional neurological disorder language is the language that gets used. Yeah. This one frustrates physicians. I had a different client who had seizures, psychogenic seizures, which is the same thing. No physical basis for it, no epilepsy. And she actually had a seizure in the neurologist's office, and the neurologist ended up yelling at her to stop. Well, that's not really like that hasn't been shown to be clinically effective. And so they do get really frustrated with that. But the approach I take with this is actually different from what I do with a lot of my clients, with a lot of things I work with. I don't want to let the whole cat out of the bag. No. This is a fun presentation. I enjoy it. But the stuff that I do to treat this is actually much more like the kind of things that I do when I'm screwing around at parties and having fun, as like the guy that was introduced as a hypnotist, rather than the kind of thing that I typically do in a session with a client. So it looks really different. So I've noticed I haven't hit your heights as a stage hypnotist. Like I don't run out and do that kind of thing, but I am fun at parties. And
sure,
the things that I do to treat this are actually exactly the kind of stuff that I do when I'm screwing around at parties. And so it's a really different looking session. It's a lot of fun. The process, just, you have to have confidence to go in with it, but like it works great. And it's interesting. Like, I wish we had that conversation back then, because honest to goodness, Paul, as a stage hypnotist with the kind of skills that you'd have to do that, you'd be great at working with this. Like, it would be, so it's a matter of the knowledge base, like just knowing how to approach it.
Exactly.
And the people that have come in with this are desperate, because I can't diagnose as a counselor, I can't diagnose a conversion disorder until physicians have said there is no medical diagnosis. Like, they have to have been through the whole thing.
Yeah.
I had a 29-year-old healthy woman who would pass out when everything stressful happened. That's a good way to get killed. Like, she had a cardiologist look at her for a month. She had neurological scans. She had all this stuff. By the time she came into my office, she was so desperate, and we were able to handle it. Like, she got better. It's great. Like, this is a phenomenal thing to be able to offer to your clients.
It's awesome.
It'll be fun.
All right, y'all. That's it right there. All right. Sunday, 2 p.m. Speechless for 6 months with Frederick Ma. He's always, I'll tell you, I've sat in on Frederick's stuff before. I guarantee you will learn a lot. He's very good at packing a lot of information into his presentations, and they're never, ever anything less than fascinating. So spend some time with him and enjoy yourself. This is why we go to convention. And this is not a topic that probably gets presented on at a lot of other conventions that are out there. So this is a special one. So Frederick, I look forward to seeing you in August.
Paul, I'm looking forward to seeing you. Thank you so much.